Just like in the lower cervical video clip, we showed you a very important examination procedure called passive segmental translation. It's a linear movement that places a shearing load through the disc joint and will separate or distract the facet joints. If a motion segment is unstable due to disc degeneration and that segment's moving too much, the facet capsules will elongate, okay, they'll become redundant, and the disc will allow excessive translation through the segments. So there's several good ways to perform this test. And in this video clip, I'm just going to do one version. It's probably the version that I like personally the best when I'm assessing for excessive translation at a lumbar segment. Hand is inside lying here. Hips are less than 60 degrees. You have to confirm that there's no kyphosis in the lumbar spine and that there's no excessive side bending. If you see excessive side bending, you can place a little flattened towel here, and that would be fine. But just make sure that the lumbar spine in particular is not flexed. Okay? So I'm going to move my right thigh to Hannah's tibial tuberosities, essentially. Okay? And then I'm going to bring my cranial hand, which is my left hand in this case, to the L5-S1 motion segment. Remember that the base of the sacrum is the lower vertebrae at the L5-S1 segment. Palpating at the interspace with my left hand, I'm going to pull the base of the sacrum forward. That moves the S1 facets, which are in front of, that is anterior to, the inferior facets of L5. That will distract both facets and cause a shearing motion through the L5 disc. Now I'm going to go to the L4-5 interspace. Palpating with my left hand. I'll bring my caudal right hand onto the bilateral lamina of L5. The bilateral lamina is just on each side of the L5 spinous process. And I'm going to pull in a forward or ventral direction. This distracts the facet joints at the L4-5 interspace and again places a shearing load through the L4 disc. If there's early grade disc degeneration, and that's using the Furman scale, which we'll talk about in other classes, you were introduced to that in your imaging class. If there's a grade 1 through grade 4 disc degeneration, that segment is likely going to be loose. If a segment reaches grade 5 disc degeneration, it will have reached what Kirkcaldy-Willis calls the stabilization phase, and you'll feel little to no segmental translation. One additional point in this video clip, if you feel as though you feel excessive translation, and if during active motion testing the patient demonstrated one of these visual indicators of instability that we've been talking about, make sure that without any motion at all, you do light interspinous space palpation at L5, at L4, and at other segments too. A segment that is symptomatically hypermobile, okay, will typically be tender at that interspinous space.